We're going to demonstrate mobilization of the OA. This is seated and weight bearing, and we're going to position the patient in the chair, and the clinician basically gets behind the patient, and what we're looking for is we're coming off the mastoid process, and we're going to find the transverse process of C1. Now our axis of motion for flexion and extension is going to be through the ear. So we're just in the upper cervical spine, which has to do with C2 and above. And this is at OA, at occiput C1. So I'm basically putting my fingers right at the occiput, at the mastoid process, and right in the space where C1 is, at the transverse processes, and I'm going to move him into flexion. I'm going to move him into extension. Remember, you're keeping the axis through the ear. You're not going too far, too soon. I'm looking for approximation when I go into extension of the occiput onto C1, and I'm looking for separation of the occiput onto C1 in flexion. This is in weight bearing. We also, from this position, can do side bending. With side bending right, I move the head to the right. Now, my axis of motion is going to be through the nose with side bending. My fingers are still on C1 and mastoid process. I'm going to side bend right, and I'm going to feel the motion that takes place with the rotation component of C1 with occiput. Side bend left, I see the rotation component. When I go into rotation, I'm going to minimally rotate the head. The motion or the axis is going to be through the spinal cord with rotation. I will minimally rotate the head motion. There should be palpation during the first 3 degrees of rotation, and with this rotation the clinician is going to feel a little bit of end feel here. When he gets to the end range, then you're going to feel C1 once again get taut, and there'll be motion taking place at that point. This is all through the upper cervical spine, OA with weight bearing. Then we're going to demonstrate it in supine with non-weight bearing.